Now, the Health Department has announced that it will terminate 800 contract workers, including doctors and nurses, despite a shortage of healthcare practitioners. They were recruited at the height of the COVID-19 pandemic. For more on this, we're joined by Joburg MMC Ashley Sauls. Ashley, good evening to you. Thanks for your time. Look, we've seen these workers protesting at different institutions, health institutions, because, number one, it's not just the facilities that are saying, we need to have these staff members here to help us provide services to the community. But they also are asking themselves questions about what becomes of their future now. Why was there no other alternative to what we're facing?
Thank you, Kathy. I think what we must first do is differentiate between what the issue in the city of Joburg is and what is happening provincially. Provincially, the issue of non-payment of nurses is not the issue in the city of Johannesburg. The city of Johannesburg, the challenge is the EPWP program. That is a program that we get funded for by the provincial health department to have a situation where young people are roped into this particular program for 12 months, a maximum of 24 months, and it's an exit program. So the idea is to give job experience to young people. So now the contract has come to an end, or is already ended 30th of June. So that's where the challenge lies. So now the contract has come to an end. The Department of Health in the city of Johannesburg is not terminating any contracts. The contract has come to an end, and this is the EPWP program. It is not what is perceived to be the matter here, that people are being let go just as a matter of discretion from our part. It's not the case.
So effectively you're saying that those who were hired under the provincial department also during the period of COVID-19 to go serve at your hospitals such as your Chris Hani Baragwanath, those are not necessarily affected by the current contracts that you're talking about here?
No, firstly, we should differentiate between what our competency is and that of provincial. Hospitals, for example, is not the competency of an MMC like myself. It's the MEC. Therefore, the MEC is responsible for answering those particular questions as it relates to hospitals. But you are correct when you say that there are nurses that has been contracted specifically for COVID-19. And those contracts also has come to an end because now COVID-19 is considered to have been dealt with. And so now there is a renewed process where those very people can be part of the system again. And as a matter of fact, we are engaging on that particular matter to say that we have to look into them not being last in the line. We've got to consider them first as we now looking at bringing in more nurses. So it is not from our side, on COJ side. We are merely dealing with contracts ending. And so we need to differentiate between that and the EPWP protest that is currently happening.
These are skills at the end of the day that cannot afford to be lost to the economy. So once these contracts end, what are the options that are available to those that have been part of them?
Well, as it relates to the EPWP program, which is funded by province, which is just supposed to be for 12 months, which is targeting young people, that has to, once that period has ended, it has to end, and a new bunch of young people needs to come into the program. That's for one. So it's not that the program itself is stopping. It's just that people has been promised by the previous administration that they who are part of the EPWP program is going to be made permanent and so on, which was a lie. So our position is we need to act with truth and transparency, that when you sign the contract, you sign it for a particular period, that period is exhausted, it's going to end, and we're going to bring in a new bunch of young people.
Yes,
that's the truth.
I understand that, but what I'm saying is ultimately this is money that is spent training young people, this is taxpayer money, and these are skills that we don't want to lose to the public service because these are skills that are needed anyway. So beyond the program, what is the pipeline that has been put in place to ensure that these skills are not lost altogether? That's what I'm asking.
Yes, and again, we should ask what is the responsibility of local government. We are implementing agents for the program called the EPWP program. And so we just have to fulfill what the program is about, which is young people need to get exposed to job experience, and they need to receive particular training, And all they do is they then provide education around HIV, TB, and other diseases. That is the program itself. And we have engaged outside of this particular program, we have engaged other centers which provide skills. And we are saying that there needs to be intentionalism around training young people, also with accredited training, so that when they are done with this program, that they have something that is accredited that they can use when they look for jobs and they go out there into the job market. So there are three things that was queried here. One, the contracts ending. Two, the fact that some of them has been short paid. And three, about the accredited programs. Now, because we operate with truth and transparency, we looked at, from our office, to say between the officials and the employees, what are the things that the city needs to take responsibility for? There's nothing that can be done about the contracts ending, but were they short paid? And there was some that was, and we ensured that HR deals with that matter, because you cannot now say that the city cannot take responsibility for where they have earned, and we have ensured that that has happened. So from our side...
So if I hear you correctly, Ashley, your approach as those that run this program is that you are only responsible for what happens in the 12 months or the 24 months that one is contracted to be an EPWP worker, and that beyond that, it actually is no longer within your realm of responsibilities to care about what happens after these young people have been through this program.
No, I'm actually saying to you that when I came into office, which was very recently, I acknowledged the fact that there's no sufficient provision made to equip young people for after the program. And as we speak, we are saying we agree that we need to ensure that more is done. We've engaged province on this matter because we are implementing agents. And we went out on our own to say, let us have more support structures around assisting young people to be better equipped. And that's where the skills training, accredited training came about. And we offered that. As we speak, we are forming partnerships to ensure that that happens. So we are going over and above what we are supposed to do because we agree with you, Kathy, and we agree with the young people that are crying out. But as far as the actual program, I'm not going to be the type of politician that's going to lie to people just to be popular. I've got to be truthful, because being truthful allows us then to avoid what has happened before, where people has been given false promises by, as they claim, provincial government to say that they will be made permanent in the EPWP program, which is not correct. It's not true. And if we're going to continue with that lie, what are we feeding into? So that is wrong. So at the risk of not being popular, I've got to be truthful.
Let's go back to the point of integration that I raised initially, that this is taxpayer money that is being spent to help skill these young people and take them through this program.
Yes.
Surely there must be some kind of pipeline that looks beyond the 12 or even 24 months of what happens once we've spent X amount of money and X amount of time equipping these young people.
I agree with you. And that's the reason why we are asking the same question, and we are not just asking the question only. We haven't received a positive response. When we asked this question to province, we haven't received a positive response, but what we have done is we've been proactive to say that whilst there is nothing happening, we need to then be proactive in trying to ensure that that takes place. And that's where us approaching outside skills centers to provide accredited training, we are doing that on our own. Because we agree with you, Kathy.
The Health MMC in the city of Joburg, Ashley Sauls, will leave it there for tonight.